Hello and welcome. Today we're diving into the world of ocular health to explore a condition known as primary acquired melanosis, or PAM. This intriguing disease affects the conjunctiva, the clear membrane covering the white part of your eye. Join us as we unravel its complexities, from its causes to its management. Let's begin with the etiology or the causes of PAM. Unfortunately, the exact remains largely unknown, making it somewhat enigmatic. However, researchers believe that it's primarily related to an increase in melanocytes, the cells responsible for producing melanin, within the conjunctiva. Genetic predispositions and chronic sun exposure are suspected to play a role in triggering this cellular change. Think of it like this: some people's skin tans more easily than others. Similarly, some people's conjunctivas may be more susceptible to developing PAM. Now, let's discuss the pathophysiology. In essence, PAM arises from the abnormal proliferation of melanocytes within the conjunctival epithelium. These melanocytes then produce melanin, leading to the characteristic pigmentation seen in PAM. What differentiates PAM from a simple freckle is that these melanocytes can sometimes exhibit atypical features, increasing the risk of transformation into a more serious condition. It's like a garden where some flowers grow normally, while others start to show unusual characteristics, requiring careful monitoring. Regarding epidemiology, PAM is considered a relatively rare condition. It primarily affects middle-aged to older adults, and there doesn't appear to be a significant difference in occurrence between men and women. While it can occur in people of all ethnicities, it seems to be more commonly reported in Caucasians. The incidence might also be influenced by geographical location, potentially due to variations in sunlight exposure. Moving on to signs and symptoms, PAM often presents as a flat, brown discoloration on the conjunctiva. This pigmentation can vary in size, shape, and intensity. It's typically painless, and patients may not even notice it initially. However, subtle changes, such as an increase in size, darkening of the color, or the appearance of raised areas or blood vessels, should prompt immediate evaluation by an eye care professional. Think of it as a subtle shadow that grows larger over time. Diagnosing PAM requires a thorough clinical examination by an ophthalmologist. This involves careful inspection of the conjunctiva using a slit lamp microscope. The ophthalmologist will assess the size, shape, color, and location of the pigmented lesion. Crucially, a biopsy is often performed to obtain a tissue sample for pathological examination. This biopsy helps to determine if the melanocytes are benign or if there are any signs of malignant transformation. It's like sending a sample from that unusual flower to a laboratory to determine if it's healthy or diseased. While there aren't distinct classifications or subtypes of PAM like some other diseases, PAM is primarily classified based on whether it exhibits atypia or not. PAM without atypia is considered benign, meaning the melanocytes appear normal under the microscope. PAM with atypia indicates that the melanocytes show abnormal features, increasing the risk of developing into conjunctival melanoma. Treatment and management of PAM depend largely on the presence or absence of atypia. For PAM without atypia, close observation is usually recommended, with regular check-ups to monitor for any changes. If PAM with atypia is diagnosed, treatment options include surgical excision, cryotherapy of freezing, topical chemotherapy with mitomycin C, or even radiation therapy in some cases. The goal is to remove or destroy the abnormal melanocytes and prevent the development of conjunctival melanoma. It's like weeding the garden to remove any potentially harmful plants. Unfortunately, because the exact cause of PAM isn't fully understood, there are no definitive preventive measures. However, protecting your eyes from excessive sun exposure by wearing sunglasses with UV protection and a wide-brimmed hat is always a good idea. Regular eye exams are also crucial for early detection and management of any potential issues. The prognosis for PAM depends largely on whether it is associated with atypia and the effectiveness of treatment. PAM without atypia generally has an excellent prognosis with regular monitoring. However, PAM with atypia has a higher risk of progressing to conjunctival melanoma, which can be a serious and potentially life-threatening condition. Early detection and appropriate treatment are key to improving the prognosis. Research continues to focus on understanding the genetic and molecular mechanisms underlying PAM and conjunctival melanoma, with the aim of developing more targeted and effective therapies. Studies are exploring novel drug delivery methods and immunotherapeutic approaches to improve treatment outcomes and prevent recurrence. The future of PAM and conjunctival melanoma management lies in personalized medicine, tailored to the individual patient's specific tumor characteristics. Thank you for joining us on this exploration of primary acquired melanosis.